Gentlemen, good to see you. You've got to know that the government-run option is in deep trouble when even the New York Times on its front page today predicts its demise. Congressman Cassidy, is it dead? And if so, why?
Well, I think it's dead, although the president continues to advocate for it. And the reason would be that in August, the American people spoke. The American people are clearly concerned about the government option, cost, and intrusion into their lives. The very fact that the president still advocates it makes me wonder if he's actually heard. Yeah. But I do think that senators and representatives have heard.
Congressman Altmaier, the president has been criticized by members of your own party for failing to take a strong leadership position. He has vacillated, he has prevaricated, and as recently as Wednesday evening in the joint address before Congress, I presume you were there, he tried to have it both ways. Is the president to blame for its failure?
Well, I think that the American people have spoken. I would agree with Congressman Cassidy about that. That's what we heard across the country, that there is a level of unease with the intrusive role of government in health care reform. And look, if the American people aren't comfortable with the concept of a public option as part of health care reform, then it's not going to be a part of the final package. And you're not comfortable with it either, right? You would vote against it, wouldn't you? I've already voted against the bill. I serve on the Education and Labor Committee with Congressman Cassidy, and I voted against it because I have concerns about the cost of the bill. But I think if we can do this in a deficit-neutral way, do the insurance reforms that are necessary and not impact the quality of care we have in the system today, I think we can get this done. Whether or not the public option is a part of that remains to be seen. But as I said, the American people appear to have a level of unease with the concept.
Let me stick with you for just a moment, if I may, Congressman Altmaier. Nancy Pelosi says she has the votes to pass it in your body. Does she or does she not?
Well, she may in the House, but we'll see what happens in the Senate. Right. This is legislation that has to pass both bodies and be signed by the president.
Congressman Cassidy, the leading bill in the United States Senate, the other body, calls for, as you likely know, a nonprofit cooperatives as an alternative to the government-run program. But the former health secretary, Michael Leavitt, wrote an op-ed about it, warning this, and I'll quote him: the co-ops would be federally controlled, funded, and staffed. When Washington provides the money and the names of the directors, government controls health care. If that is in fact how a co-op would be constructed, would you be against co-ops?
Yeah, if that's in fact how it's constructed, that would be a fig leaf for a public option. And I think the anger in the town hall meetings over August resulted from the American people feeling like they weren't hearing the straight story. It was kind of shifting the argument so that they would provide something that the American people actually did not like. The American people, I think, would see through a co-op constructed as Mr. Leavitt spoke of.
Yeah, Congressman Altmaier, if in fact the U.S. government controls the co-ops through both money and management, which is precisely what Senator Chuck Schumer has been arguing in favor of. Isn't that just a government-run program that is disguised as something else? And would you oppose that?
Well, as with anything, the devil is in the details. It is going to matter how the co-op is constructed and what the level of government is in oversight and the regulatory nature of the co-op. I think there are parts of the country like Seattle with group health where a co-op has worked. It's popular. It's been in effect for decades. If it's designed in a way that the American people will accept, then it's going to be part of the bill.
Let me give you a what if. If the government subsidizes it, and they staff it, and they have a say in who the controlling directors are, would you vote against it?
Well, again, my concern in voting against the bill deals with cost, the impact on small business. I'd have to see the entire bill. That wouldn't be my line in the sand as you described it. However, I would have concerns if it was designed in that way.
Congressman Cassidy, 2 weeks ago, the president said that it is a complete myth that health care reform would use taxpayer money to fund abortions. And yet, isn't it true that Democrats have turned down every proposal or amendment that would have specifically blocked that? Is that true, and what does that tell you?
Well, yes. I mean, there's a certain amount of inexactitude in definitions that's taking place here. Right now, the public option plan would take premium payments from folks into an agency set up by the federal government with rules defined by the federal government and would pay for health care on a plan that would be defined by a federal official. But these dollars are not being called federal dollars. Yeah. And so the concern is, well, it certainly quacks and whatever like a duck. Why isn't it a duck? It looks like they would be using these dollars in any other program which would be federal to pay for abortion. By the way, let me also point out, Greg, one more thing.
Okay, quickly.
They will also define the minimum standard benefit package, which may indeed include abortion for private entities, which currently may not choose to provide it, but may be required by the czar, if you will. That would be part of this plan requiring the minimum standard benefit package.
Congressman Altmaier, I need you to respond to this. I mean, if Democrats are indeed against taxpayer money to fund abortions through this health care reform, why did they vote to block specific proposals on that?
Greg, I would agree that we could be a lot stronger in the language we use in the bill to make sure that not one penny of federal funding can be used through this bill to fund abortions.
Well, why aren't your colleagues, why are they blocking those specific language proposals?
Well, look, there may be a difference of opinion. The committee on which Congressman Cassidy and I served didn't have that amendment offered, but the other two did, and the result is as you described. But from my perspective, you asked my opinion, I think we could make the language stronger. I would have supported the amendment.
Congressman Jason Altmaier, Congressman Bill Cassidy is also a doctor. Thank you both for being with us. Juliette.
Thank you.